We have here a patient of 64 years of age, a woman. Although in her ID card it was 64 years of age, she was not 64. Actually, she was 72 years. She came to us with loss of consciousness, very debilitated patient, malnourished, old, and we could find that she was suffering from IVH, intraventricular hemorrhage. You can see hemorrhage in her lateral ventricle, third ventricle. She was in coma. She was intubated. And I prescribed for her, other than other cytoprotective effect for a nervous system, like keeping sodium concentration between 145 milliequivalent per liter to 150, and other cytoprotection like giving vitamin C and prescribing gabapentin. I prescribed for her 4,000 erythropoietin a day with this notification that hematocrit should not increase more than 36, and hemoglobin not more than 12. After 7 days, she could be extubated. This is my staff, my colleague, and this is this patient, extubated, in full consciousness, and she's nourishing. Our person is giving her food. She could swallow very well, and even she could talk to some degree. This is the second case. We had a case of 81-year a man, loss of consciousness, and this ICH, intracerebral hemorrhage, with shift of the brain, and our neurosurgeons wanted to operate her, but the family of the patient did not allow us. I gave him erythropoietin, and after about 10 days, he could recover his consciousness. And this is another, in June 14, 2018, in June 21, after 7 days, the CT scan is changed. This is his ICH in the first stages of his disease, and is awake. Although because of he was so old, he could not keep his respiration physiologically, and we wanted to tracheostomize the patient, but his consciousness recovered. And the third case is a 49-year-old woman with headache, loss of consciousness to some degree, with Glasgow Coma scale of 12 to 13/15. She was suffering from subarachnoid hemorrhage. You can see hemorrhage here, here, here. She was prone to a spasm of the arteries. She went through hydrocephaly with some bloods over here. I gave her erythropoietin as well. An EVD, external ventricular drainage, was inserted within the ventricle. Her consciousness was recovered. She's smiling here. An EVD extract. Erythropoietin just 4,000 units a day. These are my staff and my colleague here. And the fourth case, the most important and the most significant case between all of this. A patient of 6 years old, a boy, went through tonsillectomy. ENT surgeon removed the tonsils, but the base of the tonsil over the carotid artery was damaged. For the bleeding through this base over the carotid artery, the surgeon once again cauterized the base, and now the gush of blood extracted from the carotid artery, and the patient could not be survived, and all of a sudden a vascular surgeon ligated the carotid artery in the left side for repairing the carotid artery. But it lasted for 2 hours. Within the operating theater, the blood pressure could not increase to the level that from this side the blood supply is provided for the left part of the brain. And the patient, after the operation, has got loss of consciousness. Emergence from anesthesia was delayed because of CVA that occurred within the left side of the brain. I prescribed for him, once again, erythropoietin, but for this 6 years, that's 4,000 units a day. His consciousness recovered as well. After 6 days, under the ventilator, he was intubated. One of my colleagues, anesthesiologist in the ICU, wanted to remove the tracheal tube, but he couldn't realize that the tracheal tube was stuck to the base of the trachea because of the blood clots gathered over the tube. And when he removed the tube, the trachea disrupted. And an emphysema occurred within 20 seconds over all parts of the body of the patient. An edema occurred within the mouth, and the patient could not be re-intubated once again. For this reason, 10 minutes of trying re-intubation was not successful, and the patients got bradycardia and arrested, cardiovascular arrest, and cardiac arrest occurred, and the patient was, a CPR was done for the patient. Within this environment, an anesthesiologist who was very successful in re-intubating the patient, re-intubated the patient once more. And now we have come across with another thing. Brain edema, hypoxic encephalopathy. We continued erythropoietin for 40 days. 40 days. This hypoxic encephalopathy, this is the patient after re-intubation in ICU, and you can see the emphysema all parts of his body. And this is the edema of the brain. And once again, some part of the brain has got injured because of low blood pressure, hypoxia, and CVA, distributed CVA now occurred for the patient. You can see the patient now here. With just a wrist drop in his right hand. He go to school, he can talk, he can walk, and this is the patient in ICU, and now the patient after 1.5 years of insult. The fifth case that I've recently come across with her is a 49 years woman with headache for 4 months, treated for migraine. She went to suburban of Tehran in Khaimshah, and she got sudden loss of consciousness. Her first CT showed widespread brain edema and infarct in the posterior fossa and occipital-temporal lobe. In both sides of occipital lobe, you can see the infarct or edema. And MRI could not be done in Khaimshah because they didn't have any facility. Suspicious of aneurysm. This is another CT scan. Edema, widespread. You can see the third ventricle, very small. And you can see the MRI after she was sent to us. Widespread ischemia and edema. And this is another MRI. And you can see within this MRA 2 points suspicious of aneurysm. That edema and infarct was due to, might have been due to aneurysm and vasospasm. And within this CT angio, the speeding might be an aneurysm. I gave her now 8,000 erythropoietin a day. After loss of consciousness, the consciousness recovered. She was extubated. He is also a fellow of ICU. I'm here, and the patient's daughter is here. The patient recovered. She's smiling. She's smiling once. Okay. And the sixth case, very significant. 47 years, female, loss of consciousness after 3 days of headache at home. History of epilepsy. No apparent history of head trauma. But she's got subacute subdural hematoma. Double mydriasis 5 minutes before craniotomy at the operating room. She was sent to the operating room in an emergent manner because unilateral mydriasis occurred for her. But 5 minutes before craniotomy, this unilateral mydriasis changed to bilateral mydriasis. After operation, her pupils were mid-sized without reflex to light. This is her first before operation CT scan with midline shift, a great midline shift. You know, here is the subdural hematoma subacute. This is her CT scan after the operation. Craniotomy was done, shift decreased. And this is her MRI. Due to that shift and decrease of the blood circulation to the brain, some part of the brain has got infarcted. Okay, let me see if this can show you. Oh no. It doesn't show the movie. You know, she's now obey order. I ask her to raise her hand. She does it, and even she can twist her head according to her order. And she is a case of double mydriasis within 5 minutes before operation, mid-size pupils without light, reflex to light, and her consciousness is going to recover every day gradually. Now, we have anti-apoptotic agent, antioxidant, anti-inflammatory, neuroprotective by angiogenesis, neurogenesis, synaptogenesis. And this is my site, personal website. You can find my slides on my website, and do not take any photograph of these slides. I will publish it on my website tonight. What do you think about this photograph? It is not EPO. It is not CNS. What do you think? Have you seen it? This is the red planet, Mars. This is the true photo from red planet that Curiosity has taken. And these light spots, this is the Earth. Believe on this small light object. So we should live in peace. Thank you very much. Is there any question?
Yes, sir. Thank you very much, Doctor. Very, very interesting. You haven't, I think, sort of indicating to it, but I still want to ask the question to be sure that I might have a confirmation for the hypothesis. Could we, though, say that EPO plays a role in the modification, in the strengthening on axonal regions? Yes. So basically it's going to enhance the axonal isolation? That's the first question. And the second question, is it playing a role enhancing basically the synaptic and dendritic growth?
Yes, to both of your questions. You know, according to Dr. Tamami, discussion regarding synaptogenesis. You know, neurites, when they grow, they should grow within the tissue. This plasticity depends on how this neurite grows within the tissue, within the matrix, extracellular matrix. This extracellular matrix should be destructed in a very regulated manner so that this neurite goes through its true pathway. So here we have MMP, matrix metalloproteinase. Matrix metalloproteinase destruct the extracellular matrix to get this neurite go through it and then reach to the axon that it should reside on. But if the matrix metalloproteinase increases, it destructs other neurites too. It regulates matrix metalloproteinase. Just increases, let the matrix metalloproteinase increase in the way that the neurites should go. And another slide I showed that oligodendrocytes, which are the supporting cells within the white matter, EPO increases the survival of oligodendrocytes and increases the myelination. For this reason, in some studies, it is said that it can be used in the treatment of multiple sclerosis too. Both of your questions is yes. The answer is yes.
Thank you.
Thank you for this very nice presentation. Very interesting presentation. I think that in the clinical use of the drug, it is a multifactorial. Yeah, so the result, it is extremely difficult to quantify how much is due to one factor or other factor. So this is, I think this is a very complex issue to quantify the improvement just from one angle. I think it is a multifactorial. The interesting cases that you show us really impressive, most of them, not all of them, but they have a multifactorial issues in the management of these patients. So all of them, each part they participate maybe in some way. The problem, as you mentioned before, in the human being, it is difficult to do basic research in this kind of pathology. So all the investigation, usually, it is in the lab. And it's not because these patients, we cannot take samples of the brain of this patient to analyze the biochemical effect of the neuroprotector. It's obvious, no doubt about this. But the data that you mentioned in the lab is confirmed. So this is in the lab, but in the human being, we cannot, unfortunately, of course, we cannot do any basic or biochemical research from samples of the brain itself, because they are, most of patients, they recover, and maybe in some autopsies, but in some cases with autopsies we can see indirectly the side effect of our management. But it is a very nice presentation with very nice cases. Thank you again.
Thank you very much for your comment. You know, the problem is that these are the first case reports. It should be confirmed through RCAs. We can, some of my colleagues told me that, please do double-blind study. I told them that I think that it's unfair that I use erythropoietin for some of the patients and I do not use erythropoietin for some of other patients. That I know that its effect is its effect. And I should, how to say, convince myself to do it once. To have some confronting indices and some RCAs can confirm this as well. Thank you, yes. These are just the case reports. I would like to publish these case reports in some magazines, neurological journals, but these are just case reports, the first case reports that you come across for the erythropoietin. Yes, it should be confirmed with RCAs. Any other question? Yes?
Perfect lecture, thank you very much. I wonder which type of erythropoietin did you use? You mentioned there are two types, this modified by cyanidization, cyanic acid, which have other different half-lives, and there are two types of receptors. So which type of erythropoietin did you use, and how do you explain these effects? If it can cross blood-brain barrier, how, in which way did you apply this treatment?
You know, there are different types of erythropoietin. As according to one of my slides, it showed that glycosylation is very important for the glycoprotein molecule itself. It changes the pharmacokinetic of erythropoietin and the half-life. And there are two sorts of receptor for erythropoietin. Yes, you were right. One kind of erythropoietin receptor is a homologous for a dimer with homologous submolecules. And one of them is heterodimer. Some part of molecule is erythropoietin conventional receptor, and some part is, and the other part is beta receptor, beta common receptor. In a recent article, it was shown that erythropoietin variant, which means that not disialic, without sialic acid, erythropoietin receptor conventional and erythropoietin receptor with beta common have the same post-receptor effect. When you use erythropoietin for erythropoietin receptor beta, it has the same post-receptor cascade of events. If you use erythropoietin variant for both of these receptors, it doesn't change the post-receptor effect. They are the same. But erythropoietin variant has 7 to 10 times, or is 7 to 10 times more potent than erythropoietin with sialic acid. Although erythropoietin with sialic acid has a more half-life, erythropoietin without sialic acid has decreased half-life, but erythropoietin variant is 7 to 10 times more potent than erythropoietin with sialic acid. But the cascade, post-receptor cascade, are the same.
Thank you.
So you spoke about multiple sclerosis, right, sir? Erythropoietin and multiple sclerosis.
Yeah.
Probably.
Yeah.
What do you think of AD, sir? Alzheimer's disease?
Yes.
Since you had mentioned about GSK3 beta and glutamate excitotoxicity.
You know, I have gathered, I've written a review article about erythropoietin, which is going to be published. One part of the article is about Alzheimer's disease, multiple sclerosis, and neurodegenerative diseases. And erythropoietin was effective in animal model of Alzheimer's disease and animal model of multiple sclerosis as well. But it has not been studied in human. This case I showed you, I think that these are not the 6 cases. I have 3 more that I couldn't gather the information to bring here. These are the first cases reported in human beings. And I think that in the near future, we will have RCAs or more study about human being with erythropoietin. But in Alzheimer's disease model in animals and neurodegenerative disorders, it was also effective. Any other question? Okay, we can go to the launch, and then if other 2 speakers appear, we can get back here. I do not know whether these 2 guys has come here or not. I don't think so. Thank you very much.